I did my undergraduate at Fordham University, which is in the Bronx in New York, and I actually grew up in New Jersey, just outside of the New York metropolitan area. I did my medical school training at Case Western Reserve University in Cleveland, and then I did my residency at Metro Health Medical Center, which is also in Cleveland. I worked for a year after I finished my residency in Cleveland for Kaiser Permanente while my husband finished his residency. And then when we moved to Kansas, I joined a private practice and was in a pretty busy group out in Kansas while Harry served in the Air Force. Actually, when I was in high school, I wanted to be a teacher for the longest time. And I think it was my junior or senior year of high school, I got a job working in an OB-GYN's office. And I was sort of the secretary, but it was a tiny, tiny little office. And there were times where if the nurse didn't show up, I would actually work in the back with the doctor. And I just thought it was the greatest thing in the world, taking care of women, and I really love obstetrics, and it kind of hooked me. So I made a switch when I went to college and became pre-med, and the rest was history. Well, I think that for a lot of women, their OB-GYN is their primary care doctor, because for many women, they will actually go to their OB-GYNs for a checkup, where maybe they won't go to their PCP or primary care doctor for a blood pressure check or whatever. So for a lot of women, I think we are kind of the gatekeeper, and you end up seeing them for their gynecologic issues, but while they're there, you can pick up on a lot of other things. So I think there's a huge role for education in my particular specialty, and you can really kind of help to keep women on the right path as far as good overall health care. You know, we've picked up patients who come in for their pap smear and their blood pressure's high, or they give you these other symptoms that think that maybe they have diabetes, or or they have a strong family history of colon cancer, so you make sure they get their colon cancer screening. So I think there's a huge role, and again, I think we kind of oftentimes fall into the role of primary care and not maybe necessarily specialists. And especially when you see somebody, because we tend to follow patients oftentimes for a very long period of time, just like a primary care doctor would. The primary care doctors see them when they're babies and follow them. Well, we see patients when they start out as teenagers, and then they get married and they have their babies. And, I have a lot of patients that I followed through the course of their lifetime, so you really kind of evolve with the patient and sort of their medical needs as things go along. That's one of the really sort of nice, rewarding things about this particular specialty. You do kind of watch your patients grow. It's a lovely hospital. The people out here are absolutely some of the nicest people I've ever met in my entire life. And you can still practice and take care of patients and do the things you love, but with a little bit of a break so that you still have some time to enjoy life. I love to travel, I love to read, I like to cook. I mean, this part of the country, which is a place that I really have never been before, is absolutely beautiful. I love to hike. My husband and I have had the opportunity to do a little bit and hope to do a lot more, and it's a beautiful area to kind of explore the outdoors, so I hope to be able to do a lot more of that.